all of this research is threatened by what is currently ongoing globally, which is this COVID pandemic. Certainly, much of our research infrastructure relies upon personnel, labs that are working, those of us that are treating patients, enrolling on clinical trials. And while, of course, patient care goes on, some of this research is more vulnerable. Do we really need to have labs, ongoing research labs, or does that put those lab investigators at risk? Should they instead be sheltering in place? So each of our personnel, we start to question whether they're necessary personnel or whether we should scale back some of that research operation. I think you can think of certain kinds of studies that are less essential, banking studies where we're collecting tissue, we're collecting blood for exploratory research. Those kinds of studies are slowing down, and some of them are stopping entirely. You can envision diagnostic studies where you're trying out a new test. Are those as important? Those are being scaled back. Therapeutic trials, therapeutic research are still very important. So our cancer patients still need treatment. They are still, living with a dangerous illness, and still their illness, their lung cancer, I'm a lung cancer doc, their lung cancer is a bigger threat to their health than the potential risk of an infectious disease. And so our treatment trials are still ongoing. We are still enrolling patients. The conversation's more difficult. And what I would say is that having this pandemic around has required us to be more flexible. We have to think about, is every visit needed? Do they really have to come in 1 week into treatment for a tox assessment? Or maybe we could do that tox assessment by phone. Do they really need to come in to pick up their drug, or could we ship their drug? And so we are, I think that this whole experience is testing our flexibility. We're using a lot more telemedicine. Patients love it. I am able to video with my patients in order to talk about their results, talk about how they're doing. And yet treatment goes on. Patients are still coming into the cancer center for their infusions. We're just finding ways to increase our social distancing, wear masks, and reduce the risk. So I would say that research goes on. Yes, it's probably slowing a bit, but the impact remains important. And I have patients signing up for clinical trials every week. They're just a little more judicious about what kinds of trials they sign up for, and they understand that we need to be flexible to keep the trials going and to keep them safe. And my hope is that we can get to the other side of this, and maybe even our cancer care and our cancer research will be better because of it. And we will be even more flexible in how we deliver clinical trials, leveraging telemedicine for needy cancer patients in the future.